in today's edition, we are looking at the profile of Dr. David Moina Senge. Now, Dr. David Moina Senge stands as a transformative figure in Sierra Leone's political and technological landscape, embodying a unique blend of scientific expertise and policy leadership. Currently serving as Chief Minister of the country, appointed in July of 2023 under President Julius Maada Bio, Senge has rapidly ascended through key government positions, including Minister of Basic and Senior Secondary Education and Sierra Leone's first ever Chief Innovation Officer. His trajectory from MIT trained biomedical engineer to government minister represents a compelling case study of how technical expertise can be applied to public sector challenges in developing nations. This profile examines Senge's background, contributions to the country and beyond, his deliverables in government, and assesses his potential fitness for higher office, including possibly the presidency of the Republic of Sierra Leone. Let's start off with his early life. Dr. Senge was born on February 25, 1986 in Sierra Leone. Some earlier sources indicated 1975 to 1976 as his birth years, but more recent authoritative sources have confirmed the 1986 date, making him approximately 39 years old as of this 2025. Dr. Senge grew up during Sierra Leone's devastating civil war that lasted between 1991 and 2002, which deeply influenced his worldview and future commitments. Though his immediate family survived unharmed, the conflict claimed the lives of two uncles, and a neighbor girl was killed by a stray bullet. Now, these experiences instilled in him both a resilience and a determination to contribute to his country's recovery and development. Let's take a look at his educational journey. Dr. Senge received a scholarship to attend the UWC Red Cross Nordic College in Norway in 2004, marking his first step towards international education. At Harvard University, he co-founded LeBon Solutions, a startup developing inexpensive batteries from microbial fuel cells, demonstrating early entrepreneurial spirit. At MIT Media Lab, Dr. Senge worked under Professor Yuhar, pioneering research using MRI technology and 3D printing to create improved prosthetic sockets that distributed pressure more comfortably for amputees. His dissertation was titled "The Use of a Novel Residual Model to Design a Variable Impedance Transvertebral Prosthetic Socket." Now, let's look at his contributions and global impact pre-government. Before joining government, Dr. Senge established himself as an innovator and change maker with significant contributions both to Sierra Leone and the global community. Dr. Senge's PhD research addressed the critical problem of prosthetic discomfort, a particularly relevant issue in Sierra Leone where many amputations occurred during the Civil War. His approach used MRI mapping of residual limbs to identify pressure-sensitive areas, multi-material 3D printing to create sockets with variable stiffness, quantitative design that eliminated subjective fitting processes, Now, his prototypes were tested by veterans and Boston Marathon bombing amputees, bringing global attention to his work. This innovation earned him the 2014 Lemkin MIT Student Prize and placement in the 2014 Forbes 30 under 30 list. Let's look at his innovation in Africa. Dr. Senge co-founded this international NGO while pursuing his PhD, serving as its president. The organization's flagship initiative was Innovate Salon, later known as Innovate Challenges, Sierra Leone's first innovation competition for secondary students. Through Innovate Salon, Dr. Senghor mentored young innovators like Kelvin Doe, aka DJ Focus. We know who Kelvin Doe is, a self-taught engineer who built batteries from discarded materials and created a neighborhood radio station from salvaged parts. Dr. Senge brought Kelvin Doe to the United States, where he became the youngest ever MIT visiting practitioner. Dr. Senge articulated a vision of shifting from aid to Africa to made in Africa, empowering local communities to develop their own solutions to challenges. The program's slogan, "We all dey make am," in other words, we're all going to make it, encapsulated this inclusive approach to innovation. Now let's take a look at his corporate research and healthcare applications. Prior to government service, Dr. Senge worked as a research scientist at IBM Research Africa in Nairobi and Johannesburg. His work focused on data-driven healthcare solutions for African contexts, artificial intelligence applications to address doctor shortages. Africa has fewer than 50 doctors per 100,000 citizens. Ebola response tools, including a web-based system for monitoring the disease in partnership with Putloko Health Management Team. And that takes us to public sector leadership and achievement in Sierra Leone. Now, Dr. Senge transitioned to public service in 2018, bringing his innovation background to government challenges. In May 2018, President Julius Maada Bio appointed Dr. Senge as Sierra Leone's first Chief Innovation Officer and head of the Directorate of Science, Technology and Innovation. Now, in this role, Dr. Senge led development of Sierra Leone's national innovation and digital strategy to guide government implementation of technology initiatives and support the National Development Plan. During the COVID-19 pandemic, Dr. Senge oversaw deployment of multiple digital tools, mobile applications and text messaging systems for information dissemination and health self-assessment. Now, the travel portal for tracking tested passengers, quarantine management app for monitoring service delivery, drone surveillance to evaluate compliance with stay-at-home orders, data analytics using anonymized call records to understand policy impacts, digital governance foundation. Dr. Senge worked to establish digital identity, digital economy, and digital governance as core pillars of government modernization. Now, as Minister of Basic and Senior Secondary Education between 2019 and 2023, as Education Minister, Dr. Senge led ambitious reforms despite challenging circumstances. Now, he championed increasing education's share of the national budget to 22%, implementing free public education for approximately 30% of Sierra Leone's population. Under his leadership, the government added 9% more students to the in-school population between 2018 and 2020, in a system encompassing 11,400 schools and 80,000 teachers. Now, Dr. Senge spearheaded groundbreaking policies to ensure education for all children, regardless of family origin, location, gender, or disability. This included overturning the ban on pregnant girls attending school, a policy change addressing exclusion that occurred during the Ebola crisis. Special attention to disabled students and other vulnerable groups. COVID-19 educational continuity. When schools closed due to COVID-19, Dr. Senge's ministry rapidly revamped radio teaching programs within 1 week of closures, expanded reach through community radio stations and new transmitters, launched SMS and USSD accessible dictionary to support learning given that 87% of the population had mobile connectivity. As Chief Minister 2023 to present, in July 2023, Dr. Senge was elevated to Chief Minister, a position that coordinates government operations and implements the President's agenda. While this role is recent, it represents increased responsibility for governance across all ministries, continued focus on innovation and digital transformation, political positioning as a potential successor to President Bio, according to some political observers. And let's assess Dr. Senge's presidential fitness. Evaluating Dr. Senge's suitability for Sierra Leone's presidency requires examining his track record, leadership qualities, and potential challenges. Now, let's take a look at his strengths and advantages. Dr. Senge has demonstrated exceptional problem-solving skills applied to practical challenges, from prosthetic design to educational access. Now, this innovative mindset could bring fresh approaches to national development challenges. His background in biomedical engineering, data science, and artificial intelligence provides valuable perspective in an increasingly digital global economy. Now, with affiliations including TED Senior Fellow, MIT Media Lab alumnus, and recognition by Forbes and Wired, Dr. Senge has access to international networks, expertise, and potential investment sources. His radical inclusion policy in education demonstrates potentially appeals to Sierra Leone's huge population and their aspirations for economic opportunity. Again, it demonstrates both ethical commitment and practical approach to addressing systemic inequalities. Now, potential limitations and challenges. While Dr. Senge has risen rapidly in government, his political experience remains relatively brief since 2018 compared to career politicians. Now, the role of Chief Minister provides broader governance experience, but questions about political durability might persist. Government requires coalition building, compromise, and management of competing interests, skills distinct from technical innovation or ministerial implementation. Now, an innovation-heavy approach might initially benefit urban educated populations more than rural communities, potentially exacerbating inequalities that, if not carefully managed. Now, as a prominent member of Bio's government, Dr. Senge would be accountable for both its achievements and shortcomings in areas like economic management and anti-corruption efforts. Now, that takes us to multidisciplinary leadership for complex challenges. Dr. David Moina Senge represents a new model of African leadership, blending technical expertise, innovative mindset, and policy implementation. His journey from researching prosthetics at MIT to overseeing Sierra Leone's education system and ultimately coordinating government operations as chief minister demonstrates exceptional versatility and commitment to national service. Now, while his presidential suitability would depend on various factors, including political developments, public appetite for his technocratic approach, and his ability to build broad coalition, Senge's track record of deliverable outcomes in education and digital innovation suggests significant potential for higher office. His unique combination of skills appears particularly well suited to 21st century challenges where technological transformation, human capital development, and adaptive governance are increasingly crucial. Perhaps most importantly, Dr. Senge embodies a vision of development that is both innovative and inclusive, leveraging cutting-edge approaches while ensuring traditionally marginalized groups where amputees, pregnant students, or rural communities participate in and benefit from progress. Now, this combination of technological proficiency and ethical commitments may well represent the future of effective leadership, not just for Sierra Leone, but for developing nations globally. That is Dr. David Moina Senge. Let me know what you think about him and whether or not he is fit for purpose.